Hey guys, so this week has been pretty fucking crazy. I had all my doctor's appointments. I had my pre-surgery physical on Thursday and I got cleared, like blood work is fine, everything was good. And today I had my meeting with the surgeon and it was it was less than ideal. I have to say I'm pretty fucking freaked out. Um, we talked about like he did like another like breast exam and basically said like, oh, this is like what the surgery is, like went over all of that again with me and everything, and that was like fine. Like I knew exactly what he was talking about, like double incision, free nipple grafts, yada yada, and then we were talking about other things, and he basically said because I'm like short but also like heavier that it's gonna be a little bit more risky, like not in terms of like I might die, but in terms of like the aesthetics, that it might like I have a little bit more of like a probability of having like an indented chest instead of like flat, like it might go in a little bit. Um and I don't know how I feel about that because like I don't know like what that looks like in my mind. I don't know. I don't know, I'm freaked out. I don't want that to fucking happen to me. I don't know. Like, surgery is really intense and I don't know, it's a lot. And that, like, might be a complication that I'm, like, at risk for. So I don't know. I don't even know what that looks like. He said that, like, it might not happen. He was like, oh, I'm gonna, like, do my best to, like, make this, like, look good. He's like, but I can't. He was like, I can't promise you that, like, you're not gonna need revisions or that, like, it's not gonna be indented and things like that. And I know that he can't like guarantee that because like no one knows like how someone's body's going to react to surgery and things like that, and how you're going to heal. um so I don't know, that really scares me because he kept saying it over and over again, like, and I think that he just like said it over and over again to get me to realize like, oh, this is a possibility. But I don't know, I'm very very anxious about it now because I don't want that to happen and I'm freaked out. um and that really scares me because I know like I'm more at risk for that. So I just don't think I'm gonna eat for 2 weeks, like at all, because surgery's in 2 weeks. So I don't know. I'm convinced like if I lose more weight, like it'll be like less worse, which like I get, but also like how much weight can I lose in 2 weeks? Like I've been like losing weight like progressively like to have surgery, but like I don't know. He said that like it'd be fine and that like basically with top surgery, it's like the aesthetics don't change, like whether you lose weight before or after surgery, usually. So he said that because I asked him, and he said like it should be fine. So like that's a thing that like should be fine. But I don't know. I'm really freaked out because it might be like indented or whatever, and I don't know. I'm very overwhelmed. And we talked about the bleeding risk and how sometimes like you need a second surgery if it starts bleeding a lot during the night when you're staying there, or like when you get home you have to like come back. He said that like most of like the surgeries that have to like happen a second time, he's like happen like he'll get a call that night or like the next morning, and it's like like your patient's like bleeding, kind of dizzy, things like that, and he'll do another surgery and fix that. But like that fucking terrifies me because I didn't sign up for this. I did not sign up for a second fucking surgery. I don't know. I don't know. Like I knew there were risks. I've known there are risks this whole time, but it's like he like went over all of the risks in details today about like all the things, and he was like, I said there's only been like a handful of times where someone's needed a second surgery, but like he has to tell me that there's a risk because that's his job, and like malpractice if he like doesn't tell me or whatever. I don't fucking know. But so that's the thing that he went over, talked about my like infection risk and how like he looked at my skin and he was like, "Oh, this might be an issue." And then he was like, "I don't think that it's an issue enough to have to like postpone your surgery." And I was like, what? What?" I was like, "It's there last time. Like I have my skin disorder, like it's on my chest too. Like fucking welcome to my hell." And so I have to like absolutely do everything that I can to get that under like my whole skin under control in the next 2 weeks, which is also really fucking me up because I can't go on steroids because that'll like make my like infection risk even worse, which I don't want to do. So that's a thing that I don't want to fucking do, and I don't know. He said that I might should I maybe should see an infectious disease doctor to see if I need to start antibiotics before surgery or not. Um and that's really like my choice. So I don't know, but I feel like I don't know, I'm catastrophizing about all of this. Like the last time that I saw an infectious disease doctor, I was 7, I think. I had to be 7, like 7 or 8. and I don't remember what he said. I was 7. All I remember is that I had a really, like, I had MRSA, and it was not a good situation, and I was in a lot of pain, and I wanted to fucking die. And I knew this doctor was like, hey, you have a risk of infection. Good luck. But, like, I don't remember him saying anything about, like, surgery or, like, dental work or whatever. But I was 7. So I'm definitely not going to remember everything the doctor said when I was fucking 7 years old. All I remember is, like, going to the doctors. That's it. I don't remember anything that happened. And my mother is absolutely not going to remember. Like, I'm not even going to ask her because she sure as fuck is not going to know. So I'm really freaked out about that. I'm supposed to call Mary. Mary's homegirl. Still Mary's homegirl. I love her. And see if she could schedule me with an infectious disease doctor within this next 2 weeks. No one's going to have an opening in the next 2 weeks. So I might have to, like, postpone surgery to see an infectious disease doctor. I don't know. He said, like, it's my choice. Like, I don't even think I'm gonna go. Because, like, if it was that big risk, I think that when I was in the hospital in December for surgery on my arm, they would have had me seen an infectious disease doctor. If it was, like, that big of a deal. And they're putting me on antibiotics anyway. Like, after, like, they start you the night of surgery. So it's not like they're cutting me open and they're like, huh, good luck, go home. Hope you don't fucking get MRSA. It's like they're putting me on antibiotics. So like I still could get an infection, but the risk will be a lot less because I'm on antibiotics. I don't know. I'm really, really scared now about all of this. It's in 2 weeks. It's really hitting me that this is real and this is happening. And now that I know about all of these other risks and, like, that my chest might be, like, indented or whatever, I'm really fucking freaked out. Maybe I should cancel surgery. I don't know, reschedule it. I don't know. I don't know what to do. I don't know what to do, and I'm really fucking scared. And I know that a lot of this is probably just, like, my anxiety being so bad that I've convinced myself that everything is gonna go wrong, but, like, what if it does? Like, I've been waiting for so long to have top surgery, and if I have it and it was terribly wrong, is any of this worth it? Like, I don't know. Like, I don't care about the scars and things like that. Like, I know they're gonna be there. I know they're gonna be really noticeable. That, like, that's something a lot of people are really worried about, like nipple sensation, things like that. Like, I know that I'm not gonna be able to feel my nipples. I'm not gonna be able to, like, get rid of the scars. Like, that doesn't bother me. But what bothers me is that, like, my chest may look like fucking, like, indented. Or I don't know. What does that mean? Like, how indented? Like, I don't know what that means. I don't know what that means, like, at all. So I don't know. I don't know. I'm freaked out. I'm really freaked out. Um so, like, I don't know. I don't think I'm gonna, like, postpone anything, like, because I know that I need to convince myself to do this. I just need a lot of, like, reassurance and motivation to do this fucking shit. And I'm really freaked out and I'm terrified and I definitely need to take some anxiety medication, like, now. So, I'm gonna go and do that because I'm losing my shit. I'll definitely make another video before surgery, like, losing my shit. So, I guess, see you then.